The phrase plastic surgery often causes confusion. Many people assume it was named after synthetic plastic, but that is not true. The term is much older than modern plastics and comes from an ancient word meaning to shape or mold. Instead of referring to a material, the name describes the ability to reshape and restore the human body. That makes the term less about what is used in surgery and more about what the surgeon is able to do. Understanding where the name comes from reveals a much deeper history of medicine, reconstruction, and innovation. Right here, on History of Simple Things. The word plastic comes from the Greek word plastikos, meaning able to be shaped or molded. It came from the verb plasein, which means to form or to shape. Long before plastic bags or containers existed, the word was already linked to changing form. In Older English, plastic could describe anything that could be shaped. Clay was plastic, wax was plastic. Even artistic skill could be described that way because it involved creating form. When doctors adopted the term, they meant surgery that could reshape body tissues. So plastic surgery is best understood as reshaping surgery. It refers to procedures that alter, repair, or reconstruct parts of the body. Its connection to modern synthetic plastic is only a coincidence. Although the term came later, reconstructive surgery is ancient. Some of the earliest known examples come from India more than 2,000 years ago. Medical texts described rebuilding noses using skin from the forehead or cheek. These procedures were important because nose amputation was once used as punishment in some societies. The ancient surgeon Sushruta, often called one of the fathers of surgery, recorded techniques that were advanced for their time. His methods showed an early understanding of healing and tissue movement. This was not cosmetic surgery in the modern sense. It was about function, identity, and survival. Rebuilding damaged features could restore far more than appearance. The term plastic surgery became more common in Europe during the 18th and 19th centuries as reconstructive methods improved. One major figure was German surgeon Karl Ferdinand von Graefe, who used the term plastische Chirurgie in the early 1800s. By then, surgery was becoming more scientific. Knowledge of anatomy improved, tools became better, and later developments like anesthesia and antiseptics made operations safer and more effective. Plastic surgery became its own specialty because it required more than cutting or removing tissue. It demanded planning, precision, and creativity to rebuild shape and function. Few events shaped plastic surgery more than war. During World War I and World War II, many soldiers suffered severe facial injuries from bullets, burns, and explosions. These wounds required reconstruction of jaws, noses, eyelids, lips, and skin. Surgeons such as Sir Harold Gillies became pioneers in treating these injuries. He developed flap techniques, where tissue was moved from one part of the body to another while keeping blood flow intact. These wartime advances changed public understanding of the field. Plastic surgery was not about vanity. It was about restoring lives after trauma. Many modern reconstructive methods grew from this period. Even today, burn victims, accident survivors, and cancer patients depend on techniques developed through reconstructive surgery. Over time, another side of the specialty became more visible: cosmetic surgery. While reconstructive procedures repair damage or abnormalities, cosmetic surgery is performed to enhance appearance by choice. Facelifts, rhinoplasty, liposuction, and breast augmentation became more common in the 20th century. As celebrity culture and media grew, cosmetic procedures became the public face of plastic surgery. This created a misunderstanding. Many people began to think plastic surgery only meant beauty procedures. In reality, cosmetic surgery is just one branch of a much larger field. Plastic surgeons may also repair cleft palates, reconstruct breasts after mastectomy, treat hand injuries, or close complex wounds. The name plastic surgery remains accurate because the central skill of the field has never changed, shaping living tissue to restore or improve form and function. Techniques have evolved dramatically, but the core principle is the same one reflected in the ancient Greek root. Today, surgeons may use microsurgery to reconnect tiny blood vessels, 3D imaging to plan operations, laser technology for skin treatment, or tissue engineering to aid reconstruction. Yet all of these innovations still revolve around the idea of reshaping the body with precision. The word also reminds us that medicine is not only about removing disease. Sometimes healing means rebuilding what was lost. Sometimes it means correcting what never formed properly. Sometimes it means helping someone feel whole again after injury or illness. In that sense, the name carries both scientific and human meaning. Plastic surgery is not named after synthetic plastic. It comes from an ancient word meaning to shape or mold, which makes the name far more meaningful than many people realize. The field has always been about restoring form, repairing damage, and improving lives through skill, science, and innovation. From ancient reconstructive methods to modern microsurgery and advanced medical technology, its purpose has remained remarkably consistent. It is a specialty built not only on technique, but on the ability to help people recover function, confidence, and quality of life. Even after centuries of progress, the original meaning of the name still fits perfectly. Thank you for watching. If you have suggestions for our next video, feel free to share them in the comments below. We'll be sure to give you an acknowledgement for your contribution. Thank you for joining us on this journey through the history of simple things. Don't forget to like, subscribe, and stay tuned for more stories woven through the smallest details.